In recent days, photos and videos circulating on social media reveal overcrowded hospitals in China, overwhelmed by an uptick in infections caused by a virus abbreviated as HMPV. This virus is a common culprit of respiratory infections, particularly among young children, the elderly, and individuals with weakened immune systems. With symptoms resembling the flu, HMPV has sparked fears of a medical crisis akin to the COVID-19 pandemic. The sudden surge in respiratory illnesses across China in recent weeks brings back unsettling memories of past epidemics. Media outlets in countries such as Indonesia, Japan, and India have issued advisories urging citizens to remain vigilant and take necessary precautions. China, often the epicenter of global epidemics, especially those involving respiratory viruses, once again finds itself under scrutiny. But how dangerous is HMPV? And why does China frequently become a focal point for these outbreaks? Why China is prone to epidemics? China's vulnerability to epidemics is rooted in several unique factors. As the most populous country in the world, with over 1.4 billion people, China's urban areas such as Beijing, Shanghai, and Guangzhou are densely populated. High population density creates an ideal environment for viruses to spread rapidly. For instance, consider a scenario where one infected individual sneezes on a crowded subway train. The virus can potentially infect multiple people in mere seconds. Similarly, someone with mild symptoms riding a bus to work and returning home to an apartment complex can unwittingly transmit the virus to numerous others. The outbreak of COVID-19 in 2019 offers a stark example. Wuhan, a city of approximately 11 million people and a major transportation hub, became ground zero for the global pandemic. The virus spread swiftly across China and, subsequently, the world, transforming Wuhan from a regional city into the epicenter of a global health crisis. Another factor contributing to China's susceptibility is its cultural and culinary traditions. The use of wild animals in cuisine and traditional medicine has fostered the popularity of live animal markets. These markets often house a variety of wild animals such as snakes, civet cats, and bats in close proximity. These animals are sometimes slaughtered on site, creating ample opportunities for zoonotic viruses to jump from animals to humans. This phenomenon was evident during the SARS outbreak in 2002-2003, where the virus was transmitted from bats to civet cats and then to humans. Similarly, the origins of COVID-19 have been linked to the Huanan seafood market in Wuhan, which also sold wild animals. Although the exact origins of COVID-19 remain under investigation, such markets clearly pose significant risks. In addition to wild animals, domesticated livestock also play a role. China is the world's largest producer of pork and poultry, with industrial-scale farms housing thousands, sometimes millions of animals in confined spaces. These conditions are perfect breeding grounds for viruses to mutate and jump from animals to humans. For example, the H7N9 avian flu outbreak in 2013 originated in poultry and had a high mortality rate, particularly among individuals who had direct contact with infected birds. Similarly, the H1N1 swine flu in 2009, though originating in North America, spread quickly to China due to global trade and the country's large-scale livestock farming practices. China's combination of high population density, close human-animal interactions, extensive livestock farming, and traditional practices creates an ecosystem prone to dangerous epidemics. From SARS to COVID-19, these outbreaks serve as valuable lessons not just for China, but for the entire world on the importance of controlling zoonotic risks and improving public health measures. Understanding HMPV, how dangerous is it? HMPV human metapneumovirus is a respiratory virus that causes flu-like symptoms, which can escalate to severe respiratory problems in vulnerable groups such as young children, the elderly, and those with pre-existing health conditions. The virus was first identified in 2001, but retrospective analysis of samples from the 1950s revealed that HMPV has been circulating undetected for decades. Limited technological capabilities had previously obscured its presence. HMPV symptoms include cough, fever, nasal congestion, and difficulty breathing. In severe cases, the virus can lead to complications such as bronchitis or pneumonia. The incubation period for HMPV ranges from 3 to 7 days, and recovery typically takes an additional week. The virus spreads through respiratory droplets when an infected person coughs or sneezes, as well as through contact with contaminated surfaces. This makes public spaces and shared objects potential transmission hotspots. While HMPV shares similarities with COVID-19, including respiratory symptoms and modes of transmission, its overall impact is less severe. HMPV primarily spreads within localized settings, such as households, schools, or healthcare facilities. In contrast, COVID-19's ability to spread via microscopic aerosol particles, even from asymptomatic individuals, enabled it to ignite a global pandemic. Comparing HMPV and COVID-19, the differences between HMPV and COVID-19 extend beyond their modes of transmission. While HMPV spreads more slowly and causes illness primarily in vulnerable individuals, COVID-19's rapid transmission and high fatality rates had catastrophic consequences worldwide. Transmission: HMPV is primarily spread through respiratory droplets and close contact. Its slower transmission rate limits its impact to localized outbreaks. In contrast, COVID-19's ability to spread through both droplets and aerosols allowed it to infect people on a massive scale, even before symptoms appeared. Severity: most HMPV cases involve mild to moderate symptoms, such as cough and fever. Severe cases such as pneumonia or respiratory failure are rare and typically occur in high-risk groups. The mortality rate for HMPV is relatively low, at less than 1%. COVID-19, however, caused severe respiratory failure, multi-organ damage, and widespread mortality, with death rates ranging from 1% to 3% depending on the variant and healthcare capacity in different regions. Societal impact: COVID-19 brought the world to a standstill, triggering lockdowns, border closures, and economic recessions. Its global impact reshaped how people live, work, and interact. HMPV, on the other hand, causes localized outbreaks that do not disrupt societies on a large scale, at least, not yet. Vaccines: a major difference lies in vaccine availability. COVID-19 vaccines were developed rapidly and have played a critical role in reducing severe cases and mortality. HMPV, however, currently lacks a vaccine. This is partly because HMPV outbreaks are generally limited to specific groups and locations, reducing the urgency for vaccine development. Moreover, vaccine research is costly, and companies prioritize diseases with higher commercial potential. Preventive measures for HMPV: despite the absence of a vaccine, preventive measures can significantly reduce the risk of HMPV transmission. These include frequent hand washing. Regularly wash hands with soap, especially after touching public surfaces. Avoiding contact. Stay away from individuals exhibiting symptoms of cough or fever. Wearing masks. Use masks in crowded or high-risk areas. Environmental hygiene. Clean frequently touched surfaces, such as doorknobs and countertops. Minimizing close contact. If a family member is sick, limit close interactions to prevent the spread of infection. For most healthy individuals, HMPV infections resolve on their own. However, vulnerable populations should take extra precautions and seek medical care if symptoms worsen. Lessons from the COVID-19 pandemic. The COVID-19 pandemic underscored the importance of global cooperation, early detection, and preventive measures in managing infectious diseases. While HMPV does not currently pose the same level of threat, complacency could prove costly. Continuous monitoring, research, and preparedness are essential to mitigate the risks of future pandemics. As we navigate this evolving situation, let's remain vigilant and proactive in safeguarding public health. Thank you for following this story with CMTS Story. Your comments and insights are always welcome. See you next time as we explore new topics and uncover fascinating stories from around the world.